Berks Community Health Center Presents on BCTV is supported by the Berks Community Health Center.
Hello, and welcome to Berks Community Health Center Presents. My name is Debbie Hartranft, and I'm the Chief Community Relations Officer at Berks Community Health Center. June is Men's Health Month, and BCHC encourages all boys and men to take charge of their overall health by making informed decisions and implementing healthy habits. With me today to talk about this topic is Jeannie Stephen, who's a certified registered nurse practitioner at Berks Community Health Center, and Kay Mikey, who is also a licensed practical nurse at Berks Community Health Center, both of them at our Oak Brook location. So welcome, and thank you for joining me today.
Thank you.
This is a great topic.
Yes, it is. It's a great topic, and it's a really important topic.
Yes.
So basically, when we talk about men's health, there's really quality care for men includes...
And why don't we start the PowerPoint presentation to
sure.
support what Jeannie and Kay are going to be talking about? There we go.
Okay. So when you talk about men's health, it's quality care. It's basically kind of two fundamental elements. First, you want to do appropriate treatment for any current illnesses that a man should have. So say if you're diabetic, if you have high blood pressure, if you have high cholesterol, you really want to see your family provider and get those treated. And then also, just as important as treating current illnesses, you want to do preventative care. So a lot of guys think, you know, they're 20, 30, 40 years old, and they, you know, I feel great, I don't take any medicine, why should I see my family doctor? Yeah. And I would say it really is important to just get that physical with your family provider, because there are really kind of some hidden things that could be found in a routine checkup, such as high blood pressure, which really you don't have any symptoms. You really just don't feel high blood pressure. Also, high blood sugar can go undetected.
Yeah, and one of the analogies we've been using recently, because of one of our providers at Berks Community Health Center recommended this, is a car has these check engine lights and these lights show up that something's wrong. Your body doesn't have that. And the only really way to know is to have an annual checkup and look at those things. So it's a great point, absolutely.
Yeah, really, and you want to do, as far as your screening tests, so for preventative care for men, it's recommended really 18 and above. Go see your family provider. And cardiovascular prevention includes just in your basic physical. So you can get your blood pressure checked. Routine labs include checking for high cholesterol, checking your blood sugar, just to make sure that you're not diabetic.
Good points, absolutely. Okay, so let's talk about some of the risk factors that can be controlled.
Yes, definitely. So when we talk about cardiovascular disease, we talk about risk factors. So there's risk factors that you really can control, and then there's some that are out of your control. Some risk factors that you can control would be your diet. So you really want to follow kind of that heart-healthy diet. Do lots of fruits and vegetables. Do lean meats, fish, chicken. Really just try to stick to that, because it really is so important. When we talk about weight, it's not just because, you know, it might make you not feel so well or your clothes don't fit so well. It really can affect your health status. It can raise blood pressure and cholesterol. It can also raise your blood sugar. Other factors that we could control is exercise. So we know it's great to go out. You know, the guys go to the gym and exercise kind of tones your muscles and your bones. But it also, when you think about it, your heart is a muscle. So it also increases the strength of your heart. So diet, exercise, and then there's smoking. What can we say about smoking, right, Kay? What can we say?
Don't smoke.
Right.
Tobacco is the most important risk factor for the development of lung cancer. It also contributes to heart disease, COPD and emphysema, which are some respiratory problems you could run into long term. There's many medications available and support groups to help with smoking cessation. Your PCP and Berks Community Health Center has a lot of available resources for that.
That's right.
Right,
Yes.
right, yeah. And then lastly, alcohol. So it's kind of everything in moderation. If you're one of these guys that you're kind of like the weekend warrior and you kind of go out on a Friday night and kind of drinking lots of beer all at once, we would kind of consider that a little bit of binge drinking. There's definitely been studies that show that binge drinking can really have negative impacts on your heart. If you feel like the alcohol is a problem, definitely talk to your family provider because there's lots of support, lots of services that we can provide for you.
Absolutely.
Yeah.
And I'm assuming, you know, one or two in a weekend here and there.
Exactly.
Like you said,
Right.
moderation.
Everything
That's
in
the key.
moderation,
Absolutely.
right? Yeah.
Okay, so those are all things under our control, which is amazing, and we probably don't all follow those, but we should.
Right.
But there's some things out of our control that we really should
There
focus
is. Yeah, there's definitely things that are out of our control. So when you talk about diabetes or high blood pressure, if you can't control your genetics. So you can't control, you know, your mom, your dad, if they were diabetic or had high blood pressure. It definitely is going to put you at more risk and make it all that more important to follow with a family provider and get checked. Other things too would be your ethnicity. Studies show that, for example, like an African American male, just definitely more prone to having high blood pressure. So really important to get those things checked.
So let's talk a little bit about hypertension.
Yeah.
And I think we have, if we can put the slide up on the screen, thank you.
Yeah, so definitely hypertension. 18 and older, just go get that checkup. It includes a blood pressure check. And you may, if you're a healthy young man, you only need it every 3 to 5 years. 40 and older, I would say yearly. Blood pressure tends to kind of creep up on you. It's one of those things that you can get blood pressure elevations later in life, and also just something that you don't feel. Is that right, Kay?
Yeah, not necessarily. A lot of times when we find the blood pressure side, the patients feel well, and next thing you know, you're walking in with a problem that maybe could have been prevented.
Yeah, yeah, and very, very easy to get treatment for high blood pressure. Average blood pressure should be about 130/80.
Okay.
Yeah.
All right. All right. Hyperlipidemia? Hyperlipidemia.
Hyperlipidemia.
Lipidemia. Thank you. I'm
So-
in administration, not clinical, obviously.
That's okay. That's all right. So basically, that's high cholesterol.
Okay.
So when we talk about high cholesterol, really, it's again, it can be familial, so it can run in your family. And when you have high cholesterol, what it does is it kind of, over time, forms these plaques in the arteries, and that can lead to blockages in the arteries of the heart. So for men, it's recommended that about 25 years old, go ahead and get that cholesterol checked. And again, just a routine blood work would pick up any abnormalities. If you have issues with having diabetes or other medical issues, you might want to get it done sooner
Okay.
or more frequently.
Okay, that's really good advice. And it mentions here, if you're a smoker, smoking affects.
Oh, yes, definitely.
Really? I didn't know that.
Yeah, and it's interesting that people don't realize smoking can definitely raise your blood pressure, and it just really affects heart, lungs, so all of those things, and puts you more at risk for getting those issues,
Wow.
blockages in the heart.
All right, diabetes. Seems like this is a disease that I hear so much about and so many people suffering from it. Let's talk about that for a moment.
Yeah, definitely. So another routine blood check. Again, when we talk about risk factors, diet, exercise, weight gain, I know everybody has a busy life. It really is hard to kind of fit those little habits, those good habits, into your lifestyle. But if you can just do, what would you say, Kay, like as far as exercise, even like 15 minutes?
15 minutes to a half an hour of moderate physical activity at least 3 times a week can do you so many benefits.
Yeah.
And the other thing with diabetes, so many patients who are discovered to be diabetic will say later in the visit that they have a family history of diabetes. So I always talk to my patients and tell them, if you have a family history of diabetes, you should get it checked.
Absolutely. And you're right. Life is crazy and you don't fit it in, but you got to make it a priority. And
Right.
kind of telling myself that as
Yeah.
You do. You just have to fit it in. You can fit other things in. You got to fit that in as
Right.
well. It's really critical.
Right, right.
Aspirin.
Yeah, so aspirin's an interesting one. I mean, years ago, it used to be the AMA recommended that every adult, healthy adult regardless, would take a baby aspirin every day to protect your heart. But that's a discussion to have with your family doctor, because they have kind of changed those guidelines. And I would say, if you're more at risk for heart disease, like if you are diabetic or have high blood pressure, you would be more prone to take a baby aspirin. It does have good cardiovascular benefits in protecting the heart. So just a good reason for the guys to go and see their family provider and get that checkup.
There's a common theme here.
Yes, I know,
Have a
it
discussion
is.
with your family provider.
Exactly.
Once a year or longer, I guess, if you're younger. But, you know,
Right.
all these things could be maybe not totally prevented, but boy, it makes such a big difference.
Right.
Yeah. Kay, let's talk about cancer prevention.
So some of the bigger things that you can do is avoiding tobacco, stay physically active, try to maintain a healthy weight or BMI, limit your alcohol consumption, and protect yourself against STDs, including HPV, which men are at risk for.
Yes.
And then with summertime being here, avoid excessive sun exposure and use your sunscreen.
Absolutely. They're all fairly easy things to try to take control of and limit your possibility of cancer. I'm sure that you can't totally avoid it for some people, but if putting these things into practice definitely will make a difference.
Yeah, it's definitely prevention. Prevention is so important. Like I said, if you have these chronic illnesses, then they need to be treated, but just getting your regular physicals and following up can really prevent a lot of illnesses. And when you talk about like diabetes, I've had patients come in and they follow up with the nutritionist and they take their medications and they've actually reversed diabetes.
Wow.
Yes.
And they didn't even realize that they were diabetic when they came in just for a routine physical.
It's amazing.
Yeah.
Okay, so tobacco use, we've mentioned it a couple times with some of
Right.
these diseases, but let's talk about that as a risk factor.
Right, so definitely a risk factor.
Put you at risk for cancer, high blood pressure. We just all know that it's not good for you, but tobacco also can have effects on men's reproductive health.
Really? I did not know that.
Right, right. And so it is a tough one, you know, and we completely understand that. And sometimes I'll have patients come in and they're a little even embarrassed to admit or withhold that information that they are smokers because we all know it's kind of a little stigma in society. But there's definitely screening tests that you want to have if you are a smoker. And there's lots of support and help available, anywhere from like hypnosis to taking different medications and classes. We offer classes at Berks Community Health Center to help you quit smoking.
My parents both were heavy smokers all my life, and I'm guessing, I'm trying to think how old my son is. I'm thinking like 25 years ago, both did the hypnosis. That was it. They
Oh.
were done and remained non-smokers ever since. It's amazing, you know?
Yeah.
So
It doesn't hurt to explore the different options and see if you can find one that's right for you.
absolutely.
Yeah.
Okay. So screenings for cancers.
Yep.
Let's talk about the various screenings
Yeah,
and
so-
guidelines.
So there's lots of different screenings. So of course, colorectal is very important for men. 45 and older, I would say you definitely want to have that conversation, and actually your family provider should bring that up and just get that routine colonoscopy. It's not the funnest test in the world, shall I say, but really necessary. It's just a thorough evaluation of your colon, and a lot of times it can pick up, of course, it will pick up any cancers. If you have a clean bill of health with that colonoscopy, then you're good for 10 years.
Yeah. And I've had mine. It isn't that bad.
It's not
it
that
really
bad.
isn't. I have to
No.
say, and the prep isn't even that bad, you know, so. It's probably the worst part, but it wasn't that horrible.
The prep is actually the worst part, but maybe the upside is take the day off work, and then actually after you have your colonoscopy, you go out and eat a nice breakfast or lunch.
Absolutely. I did do that as well.
Yeah.
Okay, lung cancer.
So lung cancer screening, really, it's only specific to if you're a smoker. So if you're greater than 30 pack year is what it's called. So if you've been pack-a-day smoker for 30 years, you really want to talk to your family provider and get a screening test done. They can actually screen and check you for lung cancer. It'll also show if you have COPD or emphysema.
Wonderful. Okay. And then prostate cancer.
So prostate cancer, that's definitely a discussion with your family provider. Age 50 and older, I would definitely say it's a blood test. It's simple. If you have a family history of prostate cancer, then go ahead and have that testing done sooner.
Okay. And we're entering the summer months, so skin cancer, you talked about it a little bit earlier, but let's talk about that a little further.
With skin cancer, so I think with all of us, we kind of do our own little skin check. You get out of the shower and you dry yourself off, and you're looking at your skin as you dry. So I would say, make that extra little effort sometimes. Like turn around, check your back and, behind your legs and everything. So kind of know your body. And if you notice, we all have little blemishes and moles and things like that. But if you notice something unusual, you definitely want to bring it up to your family provider.
Absolutely.
Yeah.
Okay. All right, so moving into these immunizations. Kay, can you
Immunizations.
review kind of some of the immunizations that everyone should be aware of?
Sure. So we always recommend getting your yearly flu vaccine. There's Tdap with a tetanus booster. Adults get that every 10 years. The HPV vaccine, boys and young men can get up until the age of 26. The shingles vaccine is available for 19 to 64-year-olds. The meningitis vaccine, that's more based on your age and risk factors. Young boys and girls start getting that at age 11, and then there are the meningitis B vaccines that we recommend to our middle age, especially college students. There's the hepatitis B vaccine, and then of course our COVID-19 vaccines if you haven't gotten that final dose yet.
Yeah, I imagine we'll be reaching a point where that'll be an annual vaccine, just like a flu, I assume. We'll have to see.
And then one that's frequently overlooked, a lot of people think that if they don't engage in high-risk activity that it's not necessary, but we do recommend HIV and hepatitis C screenings. It's just a simple blood test that can be tacked on to the rest of these routine annual labs that the doctors order, the providers.
Yeah, so you talked about some testing, you talked about some immunizations. I mean, and it's not a lot. It's something you see,
Right.
develop a relationship with your provider, and they know when to test for these things and to check and keep you preventing as much as you possibly can and
Exactly.
have a long, healthy life.
Right.
So what are some common reproductive problems that men experience?
Right, so some things that are just specific to a man would be called BPH or enlarged prostate. So if we can look at this diagram up here, so that's the male reproductive system, and to describe the prostate gland is about the size of a walnut, and it kind of sits right under where the urine flows out. So for really reasons unknown, sometimes between the ages of 40 to 50, that prostate gland can become enlarged. So if you can just imagine, if it's enlarged and it's sitting where the urine is supposed to flow out, it's almost like your plumbing's getting clogged. Symptoms of BPH would be if you have to frequently start and stop your urine stream, if you have urgency, you have to get up and rush to the bathroom very quickly, if you feel like you're just not emptying your bladder. Other things would be if you're getting up at night and if you're having to use the bathroom more than 2 to 3 times at night. Definitely have a discussion with your family provider because there's lots of treatment from medications to simple procedures.
Okay. And then
Okay.
ED.
Yes, so what would Men's Health talk be without talking about erectile dysfunction or ED? So of course we see it, they see it in commercials all the time, and it's a sensitive topic. It can be difficult. I have had patients come in and they're a little embarrassed to bring up that discussion, but it's certainly feel open and free to talk about your symptoms that you're having to your family provider. A lot of times it can be medical reasons. For example, if you're diabetic, if you have high blood pressure, high cholesterol, if you're a smoker, if you're abusing alcohol, these can all lead to ED. Some emotional.
Stress, stress at work, stress with relationships, can have a really big impact on your sexual health.
Yeah, so treatment, and there are treatment options. So it's a discussion with your family provider to decide, is it an underlying condition and what are the causes. So again, at Berks Community Health Center, we have lots of new patient appointments, and please come and have that checkup done.
I mean, there obviously is a common theme through everything you spoke about today. Your family provider, that that primary care provider is so critical in meeting with them once a year or beyond that, whatever your age and whatever is appropriate, and all those screenings and discussions and immunizations and, you know,
It sounds like a lot of work, but you have one body and most of this all ties together. And most of the screenings and the lab tests that we talk about, the immunizations, it can all be taken care of in one appointment, you know?
Right, yeah, and you'd be surprised, you know, if you come in, it's, the initial visit's about a 30-minute visit, and we can get lots done, you know, so we order the blood work and the testing and get a blood pressure check, and, you know, you may be good to go and say, hey, we'll see you in a year. You're a healthy 18, 19-year-old. The other nice thing, too, is if you establish with that provider, then say you're sick and you need to be seen, you don't want to go to the emergency room for something simple. You know, if you had a sinus infection or anything, just come see us.
and you're so right. I was fortunate to have a primary care provider for 35 years. He just retired. I feel like I lost my best friend because you do. You establish that relationship over time. You trust them. If they say, this is what I think you need to do, I did it because I just believed in him, and I know he knew my history, he knew everything about me, and had my best interest at heart. So absolutely agree with you. I mean, get a PCP and develop that relationship over time, and so much can be either prevented or lessened, and tackle it together as a team. It's so important. Thank you.
Yes.
Thank you so much.
Thank
I really
you for
having
appreciate
us.
everything that you guys have done to prepare for this. It was a lot of information, but it was really easy to understand, so I appreciate that. And were you going to say something?
Oh, I was just going to say at Berks Community Health Center, we have 4 clinics, and they're all located very close in the Reading area, and we have lots of providers available. We've just hired a new physician at our Oak Brook location, so feel free to come in and make that appointment.
Yes, absolutely. Thank you so much. And to the men out there watching, please follow the advice that you were given today. Take care of yourself, follow these guidelines, and we hope to see you again next month at Berks Community Health Center Presents.
Berks Community Health Center Presents on BCTV is supported by the Berks Community Health Center.